This is the India Today Corona India dashboard, and I want to show you where we are at in this moment in India. So let's take the All India update first. We're about 3,000 odd cases, 68 deaths, 184 recoveries. As far as the states are concerned, it's Maharashtra that's now leading the tally of states most impacted by coronavirus at 423. There have been 42 recoveries and 19 deaths. Tamil Nadu is the state that's second most impacted with 411 confirmed cases and 1 death. Then there is Delhi with 386 cases, 8 recoveries and 6 deaths. Then there is Kerala at 295 confirmed cases. Kerala is the one state that's been relatively able to bring the situation under control. Here is where the virus tracker is globally. Remember, for the longest time, and let's just zoom in further so that our viewers can see this up and close. For the longest time, it was China that was leading the tally when it comes to coronavirus cases. Now, first Italy overtook China, then Spain, Germany, the United States. Now, all these countries have gone ahead of China. India, mercifully, is around number 30 in the global list of countries most ravaged by the coronavirus, and hopefully that's where we'll stay. This is not a race we're hoping to win. This is as far as the number of cases are concerned. Now let's look at the number of deaths. As far as the number of deaths are concerned, again, China was most brutally impacted, but it's countries like Italy and Spain that have really had to pay a very heavy price over the last several days. In India, the mortality level still relatively under control, but it's been said by people in government and outside that India is particularly vulnerable given the density of population, given the relatively poor state of our public health system. So, I want to show you now the two most important data markers which give you a sense of where we are at and where we could be headed next. So, let me show you where India stands vis-a-vis other countries of the world first. This is the India Today Data Intelligence Unit trajectory tracker. It gives you a sense of whether we're being able to flatten the curve or not, and that's what everybody's been focusing on. The steeper the incline of this curve, the more the spread of infection, the faster the spread of infection. The less the incline, the more you seem to have things under control. So the country in this blue is Korea, South Korea, and there you see, relatively speaking, they've been able to flatten the curve. China as well has been able to, relatively speaking, flatten the curve. In India, we're now on a 4-day cycle, which means every 4 days the number of infections are doubling. So that's a problematic area to be in. I want to show you the state-wise trajectory tracker. Now this is very crucial. Just bear with me, allow me to get into the depth of what I'm trying to show you, and then we'll talk about it. Now there are two reference lines on this screen. The first reference line is the dotted blue line. This is the line your state would be on if the number of cases, just come closer, if the number of cases is doubling every 2 days. That's the dotted blue reference line. There's another reference line which is the dotted red reference line. This is where you will be if the number of cases would be doubling every 5 days in your state. So if you're below this, it's a good space to be, which means the number of cases are not doubling every 5 days. It's taking more than 5 days for the cases to double, which is a good space to be in. And if you're on this side, it means that the number of cases is doubling in less than every 2 days, which is very problematic because it means that the infection is spreading fast. So it's in Tamil Nadu and Andhra Pradesh where just over the past few days there's been the sharpest spikes. At this moment, the greatest vulnerability is for Tamil Nadu and Andhra Pradesh. Now, it's states like Kerala which saw a huge spike towards the 10th of March where they've now been able to, relatively speaking, and I hope it stays this way, bring the curve under control. Maharashtra also is seeing, just if you come closer, you will see a sharp jump right towards the end. This is just over the past 72 hours where the cases in Maharashtra have now started jumping, and that is problematic because Maharashtra is now really seeing, just over the past sometime, a big spurt, and there have been cases in Dharavi as well. The other state that's problematic is Delhi, where again, if you see, there's been a sharp jump. This curve is a sharp jump, and that's problematic too. So that's the broad sense. But, you know, and there was a very important point that an epidemiologist made earlier. Just because your state is not on this tracker, it doesn't mean that you're safe and well, because things could change. States like Tamil Nadu, states like Kerala have a relatively better public health system. When this moves to Bihar or Uttar Pradesh, it could change. So just because you're not at this moment in an area where the curve is on a very sharp incline, it doesn't mean that that's the way it will stay. Okay, now that I've set the context, let's go across to the...
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.